Welcome to EnVue Health, Founders Friday show with your host Dr. Lecresha Sewell and Shermaya Holland.
Hi, I'm Dr. Lecresha Sewell, the CEO and co-founder of EnVue Health. Today I have with us Dr. Jessica Dowe, who is our Chief Medical Officer. Thank you all for tuning in again for another episode with us on Founders Friday. Please don't forget to like this video, subscribe to the channel, and hit that notification button. Also, don't forget to follow us here on EnVue Soup Media, on Instagram, Facebook, Threads, Blue Sky, LinkedIn, and our YouTube channel. So again, Dr. Dowe has joined us today to talk about her role and how she aligns with EnVue Health. So I let Dr. Dowe take the floor, and you can just introduce yourself to the people and let them know who you are.
Right. Well, I am Dr. Jessica Dowe. I am originally from Birmingham, Alabama. Grew up during the civil rights movement and ended up majoring in chemistry. From that, I went to Howard University and received a PhD in pharmacology. So I understand the fundamentals of science from a young age. I have been inspired by practitioners like Dr. Sewell, and it's so transformatively impactful when you can reach a patient culturally as well as extend compassionate care. So since my PhD and being in academia, I went back to medical school, and now I'm a family practitioner, and I have been doing this for over 20 years. I understand how important it is to reach a patient individually and approach their culture. That's why when Dr. Sewell approached me, and we both can transform individually people as well as in public health and globally together, what an amazing change that would be.
So as far as, I know that you mentioned that you were a family physician. Mm-hmm. You also are board certified in a specific specialty. Do you want to talk a little bit about that specialty that you're board certified in?
Right. Well, as you probably know, in family medicine, I see a lot of chronic diseases, diabetes, high blood pressure, hypertension, and so forth. But I was at a conference and I was going downstairs to get a bite to eat. And I saw over to the side a lecture hall where they were showing on the screen transformative body parts, meaning that they were obese and then not obese, or had extra weight in areas that they didn't want. So I sat in the back because I was curious. I thought he was a Roman nutritionist, learning how to do dietitian and that sort of thing. Turns out it was a bunch of physicians. Why am I telling you that? Because on the average, a physician is not trained in obesity medicine. What I'm saying is I am board certified in obesity medicine, but in medical school, you are only taught one class that has to do with overweight. And you know, if a person can lose weight, they can come off some of their medications. I mean, we can even go to where diabetes is well controlled. So that's what I'm doing now in obesity medicine that I learned when I was at this conference. I mean, it wasn't overnight. It took about 2 or 3 years of it. So we are doing well there.
Yes, absolutely. So yes, she is a rare specialist. There aren't very many board certified obesity medicine, bariatric medicine providers that are in the U.S. So very, very much so thankful for her expertise in that area. So more so when we talk about culturally competent care and health equity that we are striving for and how that aligns with our work professionally, you kind of touch base on that. But what about from a personal standpoint? Have you experienced anything that led you on this route to want to ensure that access exists, that we have health equity, that we are eliminating health disparities? Has there been anything personal? And I know you mentioned the civil rights movement and what have you. So if you want to share with the people.
Well, yes. Well, after practicing for almost 30 years now, I have a wealth of experience with patients.
Mm-hmm.
But what has personally impacted my life is that I am a Christian. And I was approached by a CEO of a inner city clinic. He offered me the position of chief medical officer. And I am so blessed to have the opportunity now to take care of culturally sensitive, vulnerable people who don't have access to hair, who don't have access to medical care, like people who have jobs and health insurance.
Right.
So any day that when a person comes in so destitute,
Mm-hmm.
So wanting to take care of themselves, but are in a position in their life right now they can't afford it, don't have a job, they have kids, they're taking care of other people's homes in order to put food on the table. I tell you, it is so impactful.
Yeah.
And for them to look just like me
Mm-hmm.
or not. I mean, because we see a lot of foreigners are here from out of other countries.
I'm sure in Kentucky.
Yeah.
So we have a large immigrant population here in Louisville.
Mm-hmm.
So yeah, I'm glad that you mentioned that as well. Which, as you mentioned, some of the reasons why EnVue Health exists, to ensure that patients have access to care, to ensure that patients are able to receive more of a personalized healthcare experience, and to ensure that they're able to navigate the health system despite all the challenges that may exist. So in regards to your years in practice and your role as chief medical officer,
Mm-hmm.
can you talk about some of your primary goals that exist when it comes to addressing the issues that may be more apparent in diverse populations?
Yes. Oftentimes, we have individuals in the clinic that I said are culturally sensitive to attending other practices and not being heard. And so where I am practicing, we see over 1,300 patients a year.
Mm-hmm.
We take care of, we have 5 locations.
Yep.
3 of those locations are in traditional African American communities.
Mm-hmm.
And from that, we can also go out to other areas in rural. So we have a mixture. It's not only African American, but it's also poor in rural areas in the Louisville community.
Mm-hmm.
And so with that impact, we are pulling in individuals from all over the state.
Mm-hmm.
Kentucky typically is a state where we have the less educated, we have the more cases of fetal death,
Mm-hmm.
and you would know about that, fetal death, and we have more young women who are becoming pregnant younger, so therefore they are at risk also for babies not being born as healthy. So it is race by race. We see a decrease. We also see that the elderly in the race population are more sick and they're dying at earlier ages, only because they don't have access to care and they don't have providers who are sensitive to the needs that they have.
Thank you for kind of breaking that down and what that looks like here. But, as we know, it is not just an issue that exists in our state. It's a national thing where we're seeing these numbers and the disparities that exist, reinforcing, again, the need for why EnVue Health exists, to ensure that we're able to streamline care for patients that may need in-person visits to specific clinics or health systems related to what we do. So taking that a step further, in the event that they do need beyond a virtual visit, we're able to align with systems that that are able to meet the need and get them in pretty quickly. in regards to meeting their all-around holistic care that is necessary to ensure we're impacting the outcomes.
And I also want to bring up an issue of mental distress versus mental illness.
Mm-hmm.
And we find that there is a terminology that we are talking to individuals that are vulnerable to let them know they aren't crazy. They're stressed.
Yes.
We're living in a society and things aren't looking very good for the future. And so to get people in behavioral health, because we have 5 different specialties at our clinic, which is primary care, adult medicine, behavioral health. We also have dentistry, and we have women's health. So having that factor where we can take care and make babies healthier and make minds healthier with healthy spirits, we should, in the long run, be able to make an impact on the health of the vulnerable population. I'm looking forward to it.
Yes, indeed. And what she's referring to are some of our referral partners that we have when she's talking about these specific specialties for in-person visits. We don't do any in-person visits through EnVue Health. We're a partner in care. So we will help you to get to places and facilities that are able to provide any in-person care that is necessary. So again, in collaboration with some of these clinics, we're able to ensure that those needs are met. What she said, mental health, physical, a physical exam, if you need dental care, what have you. Within our directory, you're able to connect with those providers and find the providers very easily. So I wanted to circle back to your role with us as the Chief Medical Officer as well. So what exactly, when I came to you talking about this grand idea with the digital health.
Always are talking grand. We always have good conversation about grand ideas.
Grand ideas. What was it about EnVue Health that drew you in, that made you decide, yes, this is what aligns with what I am seeking, this aligns with my vision for healthcare? What was it about our company that drew you in and you said, yes, this is something that I want to support and be a part of?
Well, like I said, it totally was driven by cultural sensitivity. Now, I've told you about my day job.
Yes.
And where I spend most of my time in the inner city clinic. But I still have my private practice inside, which is MedLife Fit. And I'm so enthused because of the possibility that what I do, I can't see a lot of patients just because, but the ones that I do see can be pulled into a group that will give them more exposure. So my private practice is a obesity clinic in which I actually have copyrighted a term called dance therapy, which stands for behavior change, exercise, nutrition, and a spiritual component. In that nutritional component, as an obesiologist, we are trained to actually do meal plans and take their metabolic rate and devise a meal plan for over 6 months and then see them lose their weight, help them come off of some of their medicines and get them into exercise and nutrition. I offer a class once a month, and that's where the population dynamics comes in. Because they can get online. All the people who are coming through EnVue could get online, and we could help them with their health by making them healthier through learning how to eat. I mean, because I tell you, going through McDonald's, and I shouldn't say that, should I?
You should.
But he'll probably cut it.
No.
But going through and ordering fast food and learning how to eat healthy is a difference. And I think that has culturally been deprived because people tend to think that eating fast food that's 99 cents is fast and it's quick and I'm just hungry. But you can also eat on a meal plan that can be cost effective and work in line with making you healthy.
Sure, for sure. And I can certainly see how the ability to access, again, different providers, different clinicians, different health systems through our platform could make an overall difference in the health outcomes that exist. So
yeah, especially that the mental distress
yes,
versus the mental illness.
Yes.
And we have access to providers who are culturally sensitive, just like you, just like me, just like you all.
Yes.
To help take care of you.
Yes, for sure. And so as we get closer to closing out this episode, I just wanted to touch base again, like with EnVue Health, like where in the future do you see yourself as the chief medical officer making a difference in regards to how we expand and how we meet more people?
We are on my, along this line, there are policies and procedures that need to be written. And so there are also possibilities of grant funding and having patients come in through the app and the data that we can retrieve.
Absolutely.
I mean, so the future is just open.
It's wide open, and looking forward, like you're saying, to collaborating more grant opportunities, more opportunities to get more of a proof of concept to have out for the people to advance the platform. The opportunities are wide open as we continue to grow, scale, advance, and our technology as well. So looking forward to continuing our collaboration and our impact and care. With that being said, thank you again for tuning in. And I just want to see if you have any final words before we close out the episode.
You know, as a CMO, my goal is to continue to build strategic partnerships and enhancing technological capabilities and cultivating an environment that will undermine and enhance that patients receive the individual care that they need. Because when a patient feels comfortable with their provider, it lends itself to a healthier patient. And you know what? I envision EnVue becoming a national leader here because you recognize all of the unaware clues and sensitivity that exist in all of our culturally sensitive patients. We can equip each of our patients with equality, with a commitment, with a genuineness to want to participate in their health care.
That's important.
And so in the long run, we will end up with healthier patients. So continue the good work.
Yes.
And I'm looking forward to working with you in the future.
Yes.
So that we are on the top, as far as we'll be at the top of the iceberg, healing those who need the tender care that comes from culturally sensitive practices. Well, you know, I always want to follow out with the word in Philippians 1:6. And I am certain that God, who began a good work in us, we will see it until its completion.
Yes.
And that's our close with that.
Yes, indeed. So again, thank you for tuning in. And don't forget to subscribe to the channel and to also like our video. Follow us on EnVue Soup on Instagram, Facebook, Threads, Blue Sky, LinkedIn, and our YouTube channel. We look forward to you tuning in to our next episode. Again, this is Dr. Dowe. I'm Dr. Sewell, CEO and co-founder of EnVue Health. Stay well, stay blessed. Until next time.
Goodbye.